What kind of research am I interested in? What I study at the very core is complex social systems and how they evolve over time. None of us is an island. We all exist in a kind of web of relationships. Some of these relationships embody notions of parity. For example, if you go out to dinner with a friend on a regular basis, then you probably think of them as a kind of equal because you have a symmetric relationship when it comes to having dinner with them. Other relationships might embody a kind of asymmetry or lack of equality. For example, you might always turn to someone for advice because they're older than you and maybe they have more experience in certain things. And in a community of individuals, you always find that they're connected by many different layers of relationships, some of which embody equality, others embody inequality, and together the community is the union not just of the individuals, these complex layered interconnections. Each of these layers, you can think of it as a kind of network. Energy is flowing across these networks. Love and support, stress and anxiety, money, disease is flowing across these networks. And all these layers of relationships, they exist simultaneously and they push and pull and play tug of war on the individuals. They change over time. The individuals change as a result of their relationships, and the relationships respond to the changing individuals by changing as well. That collection of individuals and their relationships as they are evolving over time, that is what I mean by a complex social system. I am a quantitative researcher. I build mathematical models that describe the structure of these complex social systems and how they change over time. One of the biggest challenges, though, is that it's difficult to collect data from these systems, so I am building new cell phone apps and sensors to collect this very interesting data from participants in scientific studies. This data can then be used to create simulations of artificial but realistic societies, and we can use those simulations to try out different policies and parameters within those policies to optimize them to have the best potential long-range effects. A lot of the studies I work on concern addiction and recovery. For example, I study people who use drugs, people who are recovering from alcohol addiction. By combining cell phone-based data collection with data science, artificial intelligence, and mathematical modeling, I seek to build what are called just-in-time adaptive interventions. These are technologies which can predict an individual's behavior in the near future and provide them with guidance and coaching to help them achieve their long-term health goals. I'm always looking for students who are interested in learning more about data analysis and computer programming and how these skills can be used to contribute to building AI-based systems that advance the public health at the level of individuals and their communities.